Alpha oxidation is required to oxidize branch chain fatty acids. Phytanic acid is a 20-carbon fatty acid widely seen in dairy products, fats of ruminant animals, meat, and in some kinds of fish. It gets oxidized in peroxisomes. As you can see, this has a methyl branch in the beta position, which makes it impossible to be oxidized by beta oxidation. So, how is this obstacle overcome? The body is now going to do alpha oxidation. So instead of oxidizing the beta carbon, we are now going to oxidize the alpha carbon. And for this, we need a special enzyme called the phytanyl-CoA hydroxylase. This enzyme is going to introduce a hydroxyl group at the alpha position. Subsequently, the first carbon will leave as a formyl-CoA, leaving behind a 19-carbon aldehyde called pristanyl. The pristanyl will now undergo oxidation to form pristanic acid, and then beta oxidation will happen in peroxisome on this pristanic acid. The first turn of beta oxidation will produce propionyl-CoA. The second turn will now produce acetyl-CoA. The third turn, propionyl-CoA again, then acetyl-CoA, and so on. You will find that in the last, you are having a 4-carbon fatty acid, the isobutyryl-CoA. Defect in alpha oxidation results in refsum disease. It is due to deficiency of the enzyme phytanyl-CoA hydroxylase, leading to high blood levels of phytanic acid and thereby neurological deficits. The symptom starts about 10 years of age because it requires that much of time for phytanic acid to get accumulated in the body and then symptoms to be produced. And you might have listened to the patient's story and how these symptoms were described by them in their own words. So that will help you to remember the clinical features. The treatment, as once again pointed out in the video, is restriction of branch chain fatty acid in the diet. Lastly, a quick word on omega oxidation. Omega oxidation happens in endoplasmic reticulum in liver and kidney. Short chain, medium chain, and long chain fatty acids, when their levels are high in the cell, they would enter the endoplasmic reticulum to get oxidized in their omega carbon. So a hydroxyl group is initially introduced by the mixed function oxidase, followed by this getting oxidized to aldehyde and subsequently the acid group. These acids will now enter into mitochondria for beta oxidation, and the final end product would be a dicarboxylic acid. It's just a way to make these fatty acids more water soluble so that they can be excreted in the urine.